Have you ever felt nervous or worried? Maybe your heart starts racing, your palms get sweaty, or you can't seem to focus on anything else. These are common signs of anxiety. Perhaps it happens before a big test, a job interview, or a visit to the doctor. That feeling is anxiety. Everyone experiences anxiety sometimes. It's our body's natural response to stress, a way of alerting us to potential danger or challenges. It's a normal part of life and can even be beneficial in small doses. For instance, a little anxiety can motivate you to prepare for a presentation or study for an exam. It keeps you alert and focused. But when anxiety becomes too strong or happens too often, it can interfere with your daily life. It can make it hard to concentrate, disrupt your sleep, and even affect your physical health. This is when anxiety becomes a problem. This essay will help you understand anxiety better. We'll explore what anxiety is, why it happens, and how it affects us. By understanding anxiety, we can learn to manage it more effectively. We'll learn about different types of anxiety, such as generalized anxiety disorder, social anxiety, and panic disorder. Each type has its own unique characteristics and challenges. We'll also look at what causes anxiety, including genetic factors, brain chemistry, and life experiences. We'll also discuss ways to manage anxiety and feel calmer. Techniques like deep breathing, meditation, and exercise can help reduce anxiety. It's important to find what works best for you. Knowing about anxiety is important. It helps us recognize when we or someone we care about might need help. It also empowers us to take steps to manage our anxiety and improve our well-being. It helps us take care of ourselves and support others who might be struggling. Whether it's through offering a listening ear, encouraging professional help, or simply being there, we can make a difference. Remember, you are not alone. Many people experience anxiety, and there are resources and support systems available to help. Reaching out to a therapist, joining a support group, or talking to a trusted friend or family member can make a big difference. There is hope, and help is available. With the right tools and support, you can manage your anxiety and lead a fulfilling life. Let's embark on this journey to understand anxiety better and find ways to cope with it effectively. Anxiety is your body's natural response to stress. It's a feeling that everyone experiences at some point in their lives. Whether it's before a big presentation, an important exam, or even a first date, anxiety can creep in and make you feel uneasy. It's a feeling of worry, nervousness, or unease. These feelings can be mild or severe, and they can affect your daily life. You might find yourself constantly thinking about what could go wrong, or you might feel a sense of dread without knowing why. Imagine your body has an alarm system. This system is designed to protect you from danger. When you face a threat, your body releases hormones like adrenaline and cortisol to help you react quickly. When you face danger, this alarm goes off. Your heart rate increases, your muscles tense up, and your senses become sharper. This is known as the fight or flight response. It prepares you to fight or flee. This response is crucial for survival in dangerous situations. However, in modern life, we often face stressors that aren't life-threatening, like work deadlines or social pressures. Anxiety is like that alarm system. It can be helpful in small doses, but when it becomes overwhelming or constant, it can interfere with your daily life. You might find it hard to concentrate, sleep, or even enjoy activities you used to love. Sometimes it goes off when there's no real danger. This can happen if your brain perceives a threat that isn't actually there. For example, you might feel anxious about a social event, even though there's no real reason to be afraid. This can be confusing and upsetting. You might wonder why you're feeling this way and struggle to find a reason. It's important to understand that anxiety is a natural response, but it can become problematic when it starts to control your life. It's important to remember that anxiety is not your fault. It's a common condition that affects millions of people. Seeking help from friends, family, or a mental health professional can make a big difference. It is a medical condition, just like a cold or the flu. There are treatments available, including therapy and medication, that can help manage anxiety. Remember, you don't have to face it alone. Reach out for support and take steps towards a healthier, more balanced life. Anxiety can feel different for everyone. Some people experience physical symptoms, like a racing heart or sweaty palms. Others might feel restless, irritable, or have difficulty concentrating. Here are some common signs of anxiety: feeling restless, wound up or on edge, easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, sleep disturbance, like difficulty falling or staying asleep, or restless, unsatisfying sleep. If you experience these symptoms regularly, it's important to seek help. Anxiety shows up in different ways. Some common types of anxiety disorders include Generalized Anxiety Disorder, or GAD. People with GAD worry excessively about everyday things like work, school, or relationships. Panic disorder. This involves sudden episodes of intense fear called panic attacks. Social anxiety disorder. People with this disorder feel very anxious in social situations. They worry about being judged or embarrassed. These are just a few examples. Remember, anxiety is treatable and there is hope for recovery. Section 5. Why do we feel anxious? There is no single cause for anxiety. It's usually a combination of factors, including genetics. Anxiety can run in families. Brain chemistry, an imbalance of certain chemicals in the brain can contribute to anxiety. And life experiences, traumatic events, stress, or childhood experiences can increase the risk of developing anxiety. It's important to remember that anxiety is not a sign of weakness. It's a medical condition that can be treated. Section 6. Finding calm in the chaos. While we can't always eliminate anxiety, we can learn to manage it. There are many helpful strategies, including breathing exercises. Deep, slow breaths can calm your nervous system. Mindfulness. Paying attention to the present moment can help reduce worry. Exercise physical activity releases endorphins, which have mood-boosting effects. Remember, finding the right coping strategies might take time. Be patient with yourself and keep trying. Section 7. Breathing exercises for anxiety relief. In this section, we will guide you through a series of simple yet effective breathing exercises designed to help alleviate anxiety and promote relaxation. These exercises can be done anywhere, at any time, and are perfect for moments when you need to calm your mind and body. Here's a simple breathing exercise you can try. It's called diaphragmatic breathing, also known as belly breathing. This technique helps you use your diaphragm properly, allowing you to take in more oxygen and reduce tension. First, find a comfortable position. You can sit on a chair with your feet flat on the ground, or you can sit cross-legged on a yoga mat. The key is to ensure that you are in a position where you can relax and focus on your breathing. You can also choose to lie down on a bed or on the floor with a cushion under your head and knees. This position can help you feel more grounded and supported. Close your eyes if you like. Closing your eyes can help you focus inward and become more aware of your breath. It can also reduce external distractions, making it easier to concentrate on the exercise. Next, place one hand on your chest and the other on your stomach. This will help you feel the movement of your diaphragm as you breathe, ensuring that you are using the correct muscles. Inhale slowly and deeply through your nose, feeling your stomach rise. As you breathe in, try to fill your lungs from the bottom up, allowing your stomach to expand while keeping your chest relatively still. Hold your breath for a few seconds. This brief pause allows the oxygen to be absorbed more efficiently by your body, enhancing the calming effect of the exercise. Then exhale slowly through your mouth, feeling your stomach fall. As you exhale, try to release any tension you may be holding in your body. Imagine that you are letting go of stress and anxiety with each breath out. Practice this exercise for a few minutes whenever you feel anxious. You can start with just a few breaths and gradually increase the duration as you become more comfortable with the technique. Regular practice can help you manage anxiety more effectively and improve your overall sense of well-being. Section 8. When to seek help. If anxiety is interfering with your daily life, it's essential to seek professional help. A therapist can teach you coping skills and develop a treatment plan tailored to your needs. Remember, asking for help is a sign of strength. It shows that you're taking charge of your health and well-being. Section 9. You are not alone. A message of hope. Living with anxiety can be challenging, but remember that you are not alone. Many people experience anxiety, and there is help available. With the right support and coping strategies, you can manage your anxiety and live a full and meaningful life. Take things one day at a time. Celebrate your progress no matter how small. And always remember, there is hope.